Dr. Dixon is particularly concerned by research showing that sustained paracetamol use over months or years causes gastric bleeding. This is particularly dangerous for elderly people, because this causes the loss of hemoglobin, the molecule in red blood cells that carries oxygen. This significantly harms their quality of life by making them feel ill and listless. There may be another reason to be wary. The U.S. drug watchdog, the Food and Drug Administration (FDA), has been issuing warnings about paracetamol and its potential link with rare but serious skin reactions. These reactions, Stevens-Johnson syndrome, toxic epidermal necrolysis, and acute generalized xanthomatosis pustulosis, are excruciating, with the skin separating from the body and sloughing off, with fatal consequences. The FDA has said, these reactions can occur with first-time use of paracetamol or at any time while it is being taken. Any patient who develops a skin rash or reaction while using paracetamol should stop the drug and seek urgent medical attention right away. Other American research has linked long-term use of paracetamol with blood cancer. In one study of nearly 65,000 people, taking paracetamol for at least 4 days a week for 4 years was linked to nearly double the risk of being diagnosed with leukemia or lymphoma. The possible mechanism for this risk has not yet been identified. Risk of overdose. The best-known danger of paracetamol is an overdose, intentional or otherwise. Excess paracetamol can overwhelm the liver's processing abilities and cause damage, resulting in acute liver failure. This can prove fatal. Concern over this led the government in 1998 to rule that shops can sell only packs of 16 paracetamol tablets. Pharmacies can sell packs of 32 tablets. But the danger remains, not least because of staggered overdosing. This is where taking just a little more paracetamol than the recommended dose over the course of several days or weeks leads to a dangerous buildup in the liver. The concern is that people can unwittingly overdose by also taking other over-the-counter products without realizing these contain paracetamol. Staggered overdosing is just as risky as taking one large overdose, according to a study from the Royal Infirmary of Edinburgh, published in 2012 in the British Journal of Clinical Pharmacology. Professor Donald Singer, a fellow of the British Pharmacological Society, warns, paracetamol is present in a range of over-the-counter medicines for coughs and colds. But 2 out of 5 people who take such remedies don't realize this. It is a useful drug when used in the right way, but it is a powerful drug with powerful side effects when taken excessively. Doctors should take a good patient history to ensure that people are not already taking it through such products. They should also ensure that patients are taking paracetamol at the lowest possible dose that can give relief. Dr. Dixon believes it is time to question our use of paracetamol as the first drug treatment of choice. An important alternative for using paracetamol for such conditions as chronic back pain is for GPs to give lifestyle advice, such as getting sufferers to exercise more and avoid bed rest, he said. But it is very difficult to get GPs to do that, not least because they are short of time. He thinks it will take between 5 and 10 years for GPs and the public to finally grasp that taking paracetamol for such problems is simply unacceptable. The question is whether that's soon enough, if the new evidence is to be believed.